On the Go podcast.
So I'm here with Professor Kennedy, who is really the host of the whole conference here. And thank you all for inviting us to this conference. We flew all the way from Amsterdam to New York. Very happy and very honored to be here. I think you don't need an introduction, but if you can give our listeners a little bit of an introduction to yourself and the main takeaway points from the conference.
Yep. Well, first of all, thank you very much for having me. And more importantly, thank you and everybody who flew here to be with this great conference. My name is Dr. John Kennedy. I'm originally from Dublin in Ireland, so I'm a European, an expat living in America for the last 25 years. This ICCRA was really set up about 13, 14 years ago because it was Nick Van Dyke and Gino Kirchhoffs, myself, and Rick Ferkel. We sat down and we said, we've got to look at better ways of treating cartilage lesions, particularly in athletes. And so we had our first meeting 13 years ago in Dublin, and since that time we've had several other meetings. This meeting, we had probably more people than ever. We had about 250 people here. There were 6 continents represented. And that really is the crux of this, to try and get an international consensus is not always easy. And I think what we've seen over the last 2 days is that robust, vigorous debate, very frank conversations, can end up in very, very valuable information where we can see that there really is a global consensus on how to treat most of these things. And that's very important for your generation so that you don't have to go through this, but you can build on it. And I think that's what we're all here for, to make the start in this. And so we're really looking forward to going to Amsterdam in 2 years' time. It's one of my favorite cities. And as I said, it's really coming home, isn't it? You know, because 2 of your mentors were involved in the genesis of this, so it'll be very exciting.
Awesome. Very much looking forward to that. Can you give us some things or some aspects that you're going to expect from the Amsterdam conference in 2027?
I think it'll be very similar to everything that we've done up to now. You know, one of the great things about this is there's a lot of powerful personalities here. But we all get on very, very well. And to me, that's it. So, you know, I hadn't seen Gino and Nick probably in about 2 or 3 years. But as soon as we meet each other, it's just like it was back in the day, just old friends getting together. It's almost like family in many ways. And so like all families, you can have minor little disputes, but at the end of the day, you hug it out and you have a beer, and I think there's probably 1 or 2 good beers in Amsterdam that we can share.
That's going to be very much for sure. Thank you very much again for being on our podcast, and we are looking forward to welcome you in Amsterdam in 2027.
My pleasure. Thank you very much.
Awesome. So I'm here with Professor Kearns from Dublin, from Ireland, and we had our last ICCRA meeting there in 2019, and now we're here in New York. I don't think you need an introduction either, but could you slightly introduce yourself and give the listeners the main takeaway points from the conference from your insights?
Yeah, so I was born in Dublin like John, but I actually work in Galway. So I'm an associate professor in the University of Galway, and I do lower limb reconstruction. So I still do hip and knee arthroplasty, but 90% of my practice is foot and ankle. My main interests now is osteochondrals. I do a lot of oats and that kind of thing, but I also do ankle fusion and replacement. So I try and provide a complete service for my patients. What I found, I think there was a little bit of frustration for me with this meeting, because I think the process has come to a point where we have correctly identified a need for combined research. These are rare conditions relatively. The results are quite close on some of the outcomes, and I think we need really big numbers, and a group like this I think is in a unique position to do a multi-center international cooperative study, which would be incredibly powerful. And that's really where I think probably we got to go. I think we've probably done as much of the perioperative consensus as we can do, probably. But maybe I'm wrong.
So that would maybe also be the challenge for 2027 and 2030, that we should really try to work more together, collaborate more in a prospective manner.
Well, I look at what you guys have done in Amsterdam, and I think if we can take models like that and mix it with a bit of what they do here in New York, and the cooperation we've seen between all the people here, I think we've got a good recipe there to design a really strong RCT in more than one country, which I think is the kind of data that we're really looking for.
Oh, yeah,
so
for sure.
Something to look forward to, and hopefully we can hammer that out in Amsterdam in 27.
Yeah. And what is the most important thing or the most exciting thing you're looking forward to for 2027 in Amsterdam, the next conference?
I think sort of the progression on from where we are now to look at some of the results of the techniques that are coming into clinical practice. Those studies that we've got ongoing will have another 2 years of research. And again, the collaborative part. I think the collaboration is really the key to pushing us forward as a specialty.
Perfect. Thank you so much for being on the podcast, and we're looking forward also to seeing you in Amsterdam 2027.
Looking forward to it.
So I'm here with Dr. Vanini. Welcome as the first guest on the podcast. Please could you shortly introduce yourself and give us the main takeaway point from the conference?
Absolutely, Jari. So I'm Francesca Vannini from the Rizzoli Institute in Bologna, Italy. I do mainly foot and ankle surgery. And well, it's such an honor to be here in this group. And I think the consensus are something that really shows how important is the group, an international group for the different views of the same topic. And this is important either to improve your knowledge of the topic itself, but either to understand how to guide your practice, and to guide your practice in order to make it nicely comparable with the others. I mean, it's important for us as a group because we are experts, we are surgeons, but we are also a group of friends that enjoy to be together and to make research together at a higher level. And to do this research on a higher level, we need to speak the same language. And so, for example, the point of having a classification for osteochondral lesions that is the same classification for everyone, that everyone agrees that is an important point, and everyone evaluates his lesion with this classification, will permit in the future to us to cooperate and put together our case series to find data with a big number that with our case series alone we could not have. So I think that the main point that I will take home is the group, and that it's a group that needs to talk to speak the same language about the topics we are debating. And then a lot of fun, of course.
All right, thank you very much. Grazie mille.
Grazie.
Grazie.
Jari, thanks so much for having me on. It was great to see you again, and great to see the Amsterdam team out in full force as usual. Love to see that you are doing these podcasts with the On Foundation, obviously, who have been incredibly innovative and supportive in the educational realm in such a really short period of time. For those who don't know me, I'm Chris Moronsky. I am at the foot and ankle division at Duke. And, I think in terms of lessons for me to take home, first of all, it was really great seeing everyone again. We were actively, planning a meeting in 2020 when COVID rolled around. And although it took a few years to get the band back together again, I always leave these, feeling energized among both, friends and colleagues from around the world. I think one interesting discussion for me was, I think, the concept of enhanced bone marrow stimulation. And we've seen that, traditionally in larger lesions, generally greater than a centimeter. And whether this is, in the U.S., things like adding extracellular matrix to the lesion, whether that's a scaffold, or whether that's sort of newer techniques such as minced autologous cartilage. there was a lot of discussion around adding these even to smaller lesions, less than a centimeter in size, where traditionally would only have been treated with, a bone marrow stimulation plus or minus perhaps a biological adjunct. And I think that's certainly, thought-provoking and, something that, while not everyone agrees, is a very interesting, concept for us to consider, over the next several years in planning projects, moving forward. And, ultimately it will be the data and the studies that determine whether that is warranted or not. But I do think, marches us down a path of trying to fill a defect with something as closely as possible to native hyaline cartilage, even in smaller lesions where traditionally perhaps fiber cartilage was seen as adequate but may not be optimal in the long term. So I think that was the biggest takeaway for me, and will be something that we need to sort out in future years.
So I'm here with Dr. De Hoge. Welcome.
Thank you very much.
Happy to have you on the podcast. Could you shortly introduce yourself and give the listeners your key takeaway point of the conference?
For sure, it's a pleasure. I'm Pieter Doge. I'm the Chief Medical Officer at a sports hospital in Doha called ISCRA in Qatar. And it's, of course, a fantastic opportunity for us to join in and level the continents and make sure that we have a non-biased statement coming up with the consensus meeting. And we're very grateful to the team here to have the chance to be part of it. So the key takeaway for me would be that we discuss the lifelong learning. We were involved in the Pittsburgh consensus, then in the following ups on the different conferences on it. But in general, it's fantastic that around every decade we can keep bringing the research together, the experience and the right people in order to support our communities with ankle injuries. Now, the key takeaway would be that there's not an end to this, especially in cartilage. The research is growing, but there's still a lot of work to do to extrapolate that to the practical session. And with that, it's our duty and our responsibility to our athletes or patients with ankle injuries to make sure that we tailor to their needs and that we bring the research and the experience together in order to keep that lifelong support.
Awesome. Thank you very much.
Pleasure.
I'm happy to be here with Dr. Yasui from Japan.
Yeah.
Please shortly introduce yourself and give your main lesson takeaway point from the conference.
Okay, thank you. My name is Dr. Sushi. I'm from Japan. I'm sorry, just kidding. Hi, my name is Yoichi Yasui. I'm from the Teikyo University in Tokyo. Thank you for your invitation here. My most important lesson this conference is to meet the friends who love the foot and the ankle, and particularly in the cartilage.
So I'm here with Dr. Giannakos from the USA at our conference. Welcome to the podcast. Could you shortly introduce yourself and then state your main takeaway points from our ICCRA 2025 conference?
Sure, yes. So I'm an orthopedic foot and ankle surgeon at Yale University. That's in New Haven, Connecticut, so not too far from here at NYU. And my subspecialty is in foot and ankle sports medicine. So I'm also the director of our International Foot and Ankle Sports Consensus Group, and very honored to be part of the ICCRA this year. Some of my takeaways from this conference is, first and foremost, just seeing how many brilliant minds from all over the world we could bring into one place and really listen to hear their perspectives on how they treat osteochondral injuries of the talar dome. Everyone's a little bit different. There's no real right or wrong, but it's really interesting to see how one injury can be treated and managed in different ways. And it's also great to hear some debates between different, areas of the world and how they're doing that, to see why people are doing one form of treatment versus another and really get their perspective. And I think that's how we can all gain knowledge so that we know exactly what we're doing with our patients, so that when we have a patient with these various different size defects, we can feel confident knowing that we are doing the best practice for them to get them back on their feet efficiently and safely so that they're happy and we're happy.
That's awesome to hear. And can you give our listeners a little bit of an insight into our next conference, where it's going to be and what combined
Yes,
it's going to be?
I'm really excited for the next conference, which will be in April of 2027, and that's in Amsterdam, and it will be a combination of both the ICCRA with our international foot and ankle sports consensus groups. And one of the things that I'm excited about for this conference is that we're going to be able to combine some of the information that we now have developed over the last several years and use that information to figure out what's the best treatment strategies in our elite athletes. Sometimes they're treated a little bit differently because they have to get back to a different level of activity, different level of sport. So we're going to come up and develop different strategies, not only for treatment, but also in return to play strategies and rehabilitation methods. So really excited to be part of that, and I think it's going to be a great group and will be a lot of fun, so people should come and join us.
Awesome. Looking very much forward to that one, and thank you very much for being on the podcast.
Thank you for having me.
So we're very happy to be here with Dr. Rick Ferkel on the podcast, and I would like to ask you to shortly introduce yourself. Most of the people know you already here, and to give the listeners your main takeaway point from the conference.
Well, thank you for having me. I'm an orthopedic surgeon in Los Angeles. Been practicing for a number of years. I specialize in sports medicine and foot and ankle. And I've been involved with cartilage research my entire career.
And so what are your main takeaway points from this specific conference?
I think number one, that we have a great need to develop better methods of diagnosis and treating cartilage problems. And over the last 40 years plus that I've been in practice, we've come a long way from offering very little to patients with cartilage lesions in the foot and ankle to developing a number of better treatment plans and protocols. But yet we're still not recreating true articular cartilage 100% for each patient the way we'd like. So we have much work to do in the future.
All right. And how did you like the discussions at the conference here?
Discussions were great. I think we had many people involved. We'd like to get more of the young people, the new young leaders for the future, involved more in developing, in talking about the protocols and newer techniques, and that'll come. It'll come more also in our Amsterdam conference in 2 years.
Yeah, we're very much looking forward to that, and thank you very much for being on the podcast and your answers.
Yes, I love Amsterdam. Looking forward to coming again.
Amsterdam 2027.
Yes.
So I'm here with David Weemans from Geislich, and amongst others we had orthopedic surgeons on our podcast, but it's also good to have you on the podcast to oversee the whole ICCRA conference from a different perspective. And we wanted to ask you just to shortly introduce yourself to our listeners and to give your main takeaway points from the ICCRA 2025 conference.
Well, thanks for having me. My first podcast. So this is new to me. I'm David. I'm with Geistlich, the Swiss company that manufactures collagen materials with our star brand Chondroguide for cartilage. And my position is VP of Regenerative Technologies.
Awesome. And what are your main takeaway points from the conference, from the ICCRA 2025 New York conference?
That cartilage is something very exciting, something that a lot of people have studied, and I think the key point is that the different perspective from researchers, from clinicians need to come together in one room, have strong debates for patient benefits, and we're happy from an industry perspective that patients can benefit from these consensus meetings.
Awesome. And what do you think is going to be most exciting for the Amsterdam 2027 conference? What are you most looking forward to?
I think it's back to the roots, but also I have very clear that the future is very promising. I think definition, getting a common language about definitions, about technologies, so then when we use a term that everyone understands the same thing under the term. Definitions, so that's a little bit setting the basics, but also looking into the exciting future that cartilage holds for us.
Awesome. Well, thank you very much for being on the podcast, and we very much looking forward to welcome you to Amsterdam in 2027.
We'll see you in Amsterdam.
Awesome. So here we're here with Dr. Irwin. We're happy to have you on the podcast, and wanted to ask you to shortly introduce yourself and give a main takeaway point for the conference for yourself.
Thanks for having me. My name is Rebecca Irwin. I'm a postdoc at Cornell University, and I'll be joining the University of Rochester this July as an assistant professor in the biomedical engineering department. So this is my first time at this conference, and coming in as a basic science researcher, it's been really interesting and exciting to see how committed the clinical side is to evidence-based practice and coming up with these consensus statements based on both clinical and preclinical studies, and it's been exciting to talk about potential collaborations and seeing how willing they are to engage with the basic science community as well.
All right, thank you very much.
Thank you.
So I'm here with Dr. James Butler from Ireland, one of the organizers of the 2025 ICCRA, together with Professor Kennedy. Could you shortly introduce yourself and give the listeners the main takeaway points of the conference?
Yeah. So my name is James. I'm currently finishing up a couple of research years with Dr. Kennedy. I'm going to start my orthopedic residency training in Albany this coming summer. So the main takeaways from the consensus was that there was 4 different topics we discussed to try and get consensus on. So the first was about orthobiologics for osteochondral lesions of the talus. So we further narrowed and identified the indications and contraindications of these products. So we focused on PRP, concentrated bone marrow aspirate, hyaluronic acid, and ADSC-based therapy, showing that most of these products are effective as both standalone treatments and adjuncts to both bone marrow stimulation and autologous osteochondral transplantation procedures, as well as scaffold procedures. The second topic we went through was about the treatment of failed primary bone marrow stimulation. So we outlined a treatment algorithm based on lesion size to guide treatment options when these patients present following a failed BMS procedure. The next topic we went through was radiographic classification systems. We discussed X-rays, CT, MRI, and then we came up with our own treatment algorithm to help determine when different treatment options should be used, depending on the size of the lesion, bone marrow edema, and cystic nature of it. And then finally, we went through both scaffold and non-structural allograft cartilaginous allografts. And there we found and very narrowed both indications and contraindications and evaluated the efficacy of these products.
All right. And what are you expecting most and thinking of the most exciting thing that's going to be for 2027 in Amsterdam?
Yeah, so we've started a research initiative where we've identified where the gaps in the research is, and then as a collective group with 30 countries from 6 different continents, we're going to get together as a group. We're going to present our retrospective data, and then going forward we'll have prospective data that we'll be doing at each following conference. The only thing I'm most excited about is probably tasting out some of the beer, particularly the Heineken in Amsterdam, so it should be good.
Awesome. Looking forward to that.
Yeah, it's going to be good.
Thanks.
Cheers.
This was ONtheGO, the podcast on orthoregeneration. For more content, stay tuned at my.on-foundation.org. Thanks for listening and have a great day.